Zang Fu, The Organ Systems of Traditional Chinese Medicine by Jeremy Voss. Chapter 9 Gan and Dan. Deficiency of Gan Xue. Origins. Factors precipitating deficient Xue or Gan disharmony will tend to cause deficient Gan Xue. For example, loss of blood as in hemorrhages. Deficient formation of Xue as in deficiency of P or of Shenjing. An injury of Gan or of Yin and Jingye by heat as in febrile diseases or blazing Gan fire. Signs. Face. Dull pale. General signs. Emaciation. Dizziness. Muscle sign. Weakness, numbness, spasm, and tremor. Eye signs. Dry eyes, blurred vision, spots in visual field. Nail signs. Pale, dry, and brittle. Menstruation signs. Amenorrhea or scanty menses. Pulse and tongues. Pulse, pulse wiry, thin, and choppy. Tongue is pale, thin, and dry, with little or no coat. The key signs of this pattern are dull pale face, weakness and spasm in tendons, brittle nails, and scanty menses. The pulse may be wiry, thin, and choppy, and the tongue may be pale and dry. Pathology. The concept of Gan Xue relates to the storage of Xue and the regulation of the volume of Xue by Gan. Deficient Xue means deficient Gan Xue, and the two patterns share the signs of deficient Xue. That is, dull pale complexion, listlessness, numbness or weak tremors in limbs, emaciation and dizziness, thin choppy pulse and pale dry, thin tongue. However, Gan Xue implies a Gan involvement in the disharmony and includes Gan signs such as wiry pulse, pale nails, muscle spasms, dry eyes, spots in the visual field, and scanty menses. Nevertheless, the two patterns of disharmony greatly overlap, and in clinical practice, deficient Xue and deficient Gan Xue are often used almost synonymously. Treatment. The principle of treatment is to strengthen Xue and to strengthen the function of Gan to store Xue. Reinforcing method is used, and moxa may be appropriate, providing that there are no signs of Xue heat. Deficient Gan Xue is unlikely to be seen in isolation in clinical practice. It is likely to occur with other disharmonies, for example, deficient Gan Yin or general deficient Xue, in which case these latter two patterns must also be treated. For example, in the case of spots in the visual field, both deficient Xue and deficient Gan Xue occur, and points such as the following may be used. Zusanli, which is stomach 36, and Pishu, bladder 20, strengthen Xue formation by strengthening the transformation function of P and Wei. Taichung, liver 3, invigorates Gan function. Ganshu, bladder 18, strengthens Gan Qi and brightens the eyes. Guangmin, gallbladder 37, regulates Gan, clears the vision. Generally, if deficient Xue and deficient Gan Xue are accompanied by deficient Qi signs, moxa is applicable, whereas if they are accompanied by deficient Yin signs, moxa is not applicable. And points such as Sai and Jiao, spleen 6, and Jiao Hai, kidney 6 may be more appropriate. Common disease patterns. This pattern may be found in such diseases as anemia, nervous exhaustion, hypertension, chronic hepatitis, amenorrhea, and some chronic eye problems. Related disharmonies. Failure of the gan function to regulate Xue is often associated with Xue deficiency. However, this failure, this failure may also be associated with depression of gan qi, with irregular storage and release of Xue, resulting, for example, in irregular on-off menstruation. Alternatively, failure of the gan function to regulate Xue may be combined with Xue heat, resulting in excess Xue in circulation and in tendency of Xue to leave the vessels, as in menorrhagia and menorrhagia. This last combination of disharmonies would manifest signs of heat, whereas hemorrhage due to inability of P to hold in within Shemai would manifest signs of cold and of deficient yang. Stagnation of Xue due to depression of gan qi or to other causes may interact with deficient gan Xue. Deficient gan Xue may result in stirring of gan wind, discussed on page 115. Hyperactive gan yang. Origins and interrelationships. The four gan patterns, deficient gan Xue, deficient gan yin, hyperactive gan yang, and blazing gan fire are so closely interwoven that they are often difficult to separate in clinical practice. These patterns may be represented as four continua: deficient gan yin to deficient gan Xue, deficient gan yin connected to hyperactive gan yang, deficient gan yin connected to blazing gan fire, blazing gan fire connected to hyperactive gan yang. The central pattern, deficient gan yin, is not listed as a main gan pattern. It is regarded more as a precursor to, or an accompaniment of, the other three patterns. Prolonged internal heat, deficient Shen yin, loss of Xue or deficient Xue, may develop into deficient gan yin. This may manifest as signs of deficient yin in the context of gan, that is, general deficient yin signs, such as palms and sores hot, afternoon fever, thin rapid pulse, and thin red tongue, plus gan signs such as spots in the visual field and wiry pulse. Deficient gan Xue and deficient gan yin reflect the underlying relationships of deficient Xue and deficient yin, and their links with deficient Jin Ye and signs of dryness and thinness. Deficient gan Xue and deficient gan yin form a continuum in which one pattern may predominate at a particular time. The signs of heat with red tongue and rapid pulse may indicate predominance of deficient gan yin. Signs of dull pale face, choppy pulse, and pale tongue may indicate predominance of deficient gan Xue. Deficient gan Ji, gan yin, hyperactive gan yang, and blazing gan fire may be seen as a continuum starting with deficient gan yin and progressing through hyperactive gan yang to blazing gan fire, with signs increasing in severity from deficient gan yin to blazing gan fire. For example, dizziness or headache may be mild, moderate, or severe. However, the differentiation between these three patterns is not just of quantity but also of quality. For example, although a hyperactive gan yang must always be associated with deficient gan yin, and therefore tends to show some signs of heat, the heat signs are not necessarily more severe than deficient gan yin. Indeed, they may be less prominent. In a deficient gan yin hyperactive gan yang pattern, signs of either deficient gan yin or hyperactive gan yang may predominate. If the former, there may be signs of deficient heat and possibly signs common to deficient gan yin and deficient gan Xue. For example, emaciation, blurred vision, and thin pulse may be emphasized. If hyperactive gan yang predominates, There may be the characteristic distending headache, fewer signs of deficient heat, and a pulse which is less thin and more floating. Though hyperactive Gan Yang has some signs of excess, it is based on deficiency and weakness and can be differentiated from blazing Gan fire by greater strength of the signs in the case of the latter. For example, where a headache is merely distending and throbbing in the case of hyperactive Gan Yang, for blazing Gan fire, it is severe and splitting. In hyperactive Gan Yang, there are small outbursts of moderate anger, and in blazing Gan fire, there may be violent fits of rage. Also, the deficient heat signs in deficient Gan Yin become excess heat signs in blazing Gan fire. For example, the whole body is hot and the whole face red, rather than palms and soles hot, with malar flushed, and the pulse is full and rapid, not thin and rapid. This situation becomes more complex when, in addition to the coexistence of the four patterns mentioned above, there is also depression of Ganqi, or when one, one or all of deficient Gan Xue, hyperactive Gan Yang, and blazing Gan fire give rise to stirring of Gan wind. Patterns of dump may also develop from these five syndromes. For example, dump heat in Gan and Dan, or P disharmonies, such as turbid phlegm disturbing the head, with signs of great dizziness, slippery pulse, and a thick, greasy tongue. This may occur in some patterns of wind corresponding to the CVA of Western medicine. Signs. The signs of this pattern derive from the interaction of the following three aspects: deficient in, hyperactive yang, and gan. Deficient gan in. Palms and soles, hot, insomnia, dry eyes, spots in visual field, dizziness, and dry mouth. Headache, distending, throbbing headache, especially in temples and or vertex, tinnitus. Emotions, anger and irritability. Tendons, numbness, spasm, and tremor. Pulse and tongue, pulse wiry and rapid, more floating if hyperactive yang predominates, and more thin and rapid if deficient Gan Yin predominates. Tongue red with little coat, perhaps dry. The key signs of this pattern are anger and irritability, and distending, throbbing, temporal, vertical headache, with some signs of heat. Pathology. The basis of such patterns as hyperactive Gan Yang, blazing Gan fire, and stirring up Gan wind is that Gan Yin is insufficient to control Gan Yang or Gan fire, which subsequently rise to the upper part of the body and the head. The Yang rises, carrying excess Qi and Xue to the head, with feeling of coolness and distension, especially in areas of the Gan channel, for example, the vertex and the Dan channel, for example, the temporal area. Deficient yin gives rise to sensation of hot palms and soles, dry mouth, thin rapid pulse, and wet tongue with a little cold. Deficient Gan Yin and or deficient Gan Xue originate signs of dry eyes and spots in the visual field. General Gan signs are numbness, spasm, and trembling of muscles and tendons and wiry pulse. Dizziness and insomnia can each occur with deficient Yin, deficient Xue, deficient Gan Yin, deficient Gan Xue, and hyperactive Gan Yang. Differentiation would be on the basis of predominant accompanying signs. For example, dizziness and insomnia due to blazing Gan fire would be severe and accompanied by other very severe signs. Treatment. The principle of treatment is to pacify Gan Yang and to nourish Gan Yin. Reducing or even method is used to pacify Gan Yang, and the reinforcing method is used to nourish Gan Yin. Points such as the following may be used. Tai Chong, Liver 3, and Xinjiang, Liver 2, both points pacify hyperactive Gan Yang. Tai Chong is used in more chronic, Xinjiang in more acute cases. These points are usually used separately, not together. Wen Qi, Gallbladder 20, pacifies yang in the head and benefits the eyes. Bai Hui, Du 20, pacifies Gan, Yang, and mind. If there is a strong underlying deficient in pattern, points such as Shen Shu, Bladder 23, and Tai Shi, Kidney 3 may be added. Common disease patterns. This pattern may manifest in case of hypertension, headaches, emotional disturbance, vertigo, tinnitus, premenstrual tension, hyperthyroidism, and in severe progressions with severe sequelae. Blazing gunfire. In the balance of deficient Gan Yin, hyperactive Gan Yang, and blazing gunfire, the predominant pattern will depend upon 1. Strength and type of constitution. A strong constitution tends to signs of fullness, in this case of excess heat. A weak constitution tends to signs of deficiency, in this case, deficient heat. Generally, in a strong constitution, the signs may be more severe than with a weak constitution. For example, the headache is more solid and severe. Number 2, circumstances. A single person may at one time manifest signs of deficient Gan Yin, for example, malar flush and mild sensations of heat. At another time, manifest signs of hyperactive Gan Yang with fullness in the head. And on yet another occasion, manifest signs of blazing gunfire with severe headache, redness of the whole face, and violent anger. The first situation may be associated with a period of tiredness and exhaustion, the second with a period of moderate stress, and the third with a period of extreme aggravation, frustration, and annoyance. Origins. A past history of internal heat and or deficient Gan Yin may predispose to blazing gunfire. This pattern may also arise from chronic depression of Gan Qi. In TCM, stagnation may eventually, over a period of time, give rise to heat and flare up as fire. Severe anger and annoyance, alcohol and tobacco, rich and greasy food may contribute to this pattern. Signs: full fire, thirst, constipation, dark urine, red face, red eyes, insomnia, hemorrhage. Head signs: violent headache, sudden tinnitus, or deafness. Emotion signs: violent anger. Gan invades pee and whey. Signs: bitter taste, sour regurgitation, nausea, pain in hypochondria. Pulse and tongue signs: pulse very rapid and full, tongue red with thick yellow coat. The key signs in this pattern are violent anger and violent headaches, plus signs of excess heat and wiry pulse. Pathology. Blazing gunfire shares with the patterns of general excess heat or blazing fire. The general excess heat signs, for example, red tongue with yellow coat, full rapid pulse, thirst, bitter taste, constipation, etc. These signs arise from the effect of heat on yin and jinya, and hence on Shen. If Xinyin and Xinxue are damaged due to the extreme heat affecting Jinye, then Shen has no residence, is disturbed, and insomnia results. The patterns of blazing Xin fire and blazing Yang fire are often closely associated, and the former may arise from the latter. Blazing Yang fire is distinguished by the sudden severe signs of anger, headache, tinnitus, and deafness, resulting from sudden ascent of hot qi and Xue to the head, ascending the Gan and Dan channels, with their distribution in the vertex and the temporal regions, respectively. Solar regurgitation is often associated with blazing Gan fire, especially if Gan invades P and Wei. The wiry quality of the pulse is due to Gan, and the full and rapid quality is due to excess heat. The red tongue with dry yellow coat is a result of excess heat, and the redness or red spots on the side of the tongue indicate Gan disharmony. This pattern is the extreme case of failure of the free-flowing function of Gan Qi, resulting in disharmony between the individual and the environment. The individual may be hypersensitive and liable to explode with rage. Sudden outbursts of extreme anger, occasionally involving physical violence, are rarely conducive to the smooth, even flow of social interaction. Treatment. The principle of treatment is to reduce gunfire using reducing method and by bleeding certain points. Moxa is contraindicated. Points such as the following may be used, depending on the particular requirements of the patient. Xinjiang, liver 2, pacifies acute flare-up of fire. Fenji, gallbladder 20, pacifies Gan and Yang and heat in the head. Zang Fu, bladder 20, bleed these points to disperse heat locally and pacify mind. Taiyang, Yongchan, kidney 1 may be added to pacify fire, strengthen yin and calm shen. Indicated for headache at vertex, vertigo, loud vision, and insanity. Common disease patterns. This pattern includes hypertension, abnormal uterine bleeding, migraine, acute conjunctivitis, and glaucoma, otitis, Meniere disease, hemorrhage or upper digestive tract, violent behavior,